Hello, all my friends out there in TV land. Good morning, good afternoon, good evening. This show is seen in so many different locations and it's seen at so many different times. I've come to the conclusion that hello and welcome. Now, this is Senior Issues, etc. I'm your host, Vita Verdon. And you know, I listened to your requests and I tried to bring you a variety. We have kind of an unusual show, and if you beware of the content of the show, don't be offended at certain anatomical names. We're putting our own censorship, but sometimes they're necessary to describe something. Now, I have a doctor with me tonight. She doesn't look like a doctor. She's very attractive. She could be a TV star, but she is a doctor of importance, and she has little children, so she has a variety in her life. Now, the contents of the show is incontinence, and that is a subject that is not discussed enough. She and her husband have a therapy clinic, the Lake County Therapy Clinic, and they have many different areas that they give therapy, and this happens to be one. And I want you to hurry up, get your coffee, get your Coca-Cola, sit down, take a pencil and paper, and I want you to give a warm welcome to Dr. Zenobia Tantra. It's so good to have you on the show today.
Thank you, Ms. Vita. Thank you for the warm welcome.
And you know, I know the folks out there. We've become friends over the years, so we've gotten really close together, casual. And what they like to hear, first of all, they like to hear a little bit about you and a little bit about your family. So why don't you tell us a little bit about yourself? Look right into that camera there.
I'll do that. But thank you for the warm welcome. And my name is Dr. Zenobia Tantra. I am a physical therapist and a DPT, a Doctor of Physical Therapy, and I'm also CAP Pelvic Floor Certified, which is the Certificate of Achievement in Pelvic Physical Therapy from the American Physical Therapy Association. And I work at Lake County Physical Therapy. We have locations, and our email address is lakecountyphysicaltherapy.com. And so please feel free to reach us there. Our phone number is 847-201-7612. And
now I know that you're married, so
yes.
I want you to send a kiss to your husband,
and my
but
children.
I want you to tell our audience out there about your children.
I would love to do that. So I'm very happily married, 22 years, to a great man, and my two adorable children, Zara and Zayden. Actually, today is my son Zayden's birthday, and if you ask him how old he is, he'll say 2. So he turned 2. Happy birthday, Zayden, and my daughter will be 2 at the end of the year. So happy birthday.
One kiss for your husband.
3 kisses, all 3 of
kisses.
them. Oh, and there's Rockstar and Bellaboo, my 4-legged canine children. So there you go.
So that's kisses for everybody. Now, where were you born?
I was born in Mumbai, India.
Uh-huh.
And I grew up there. I was there for 19 years of my life. And then I came to the United States. I got married to my wonderful husband, came here, and then I went to school here. I went to UIC, University of Illinois, Chicago, and to Rosalind Franklin Medical School, and to do my post-professional DPT, and I've traveled all over the country to get my certifications and my other continuing education classes.
Oh, that's good. Well, I think that what our audience would like to hear is what kind of therapy, the areas that your clinic covers, okay?
Well, we have several physical therapists, so we cover almost everything. We have orthopedics, we have neurology, we have niche programs like the anodyne, work conditioning, work hardening, weight loss. My personal specialty is the pelvic floor. I work with men, women, and children in working with their pelvic floor issues, whether it's incontinence, pain, pregnancy, any myriad of things.
Well, okay, we went through that. You whizzed through it really fast. Now I'd like you to go a little bit slower and give us like a description of, because most people say, well, what is considered to be incontinence? So if you could go a little bit into depth of, first of all, what incontinence is.
Absolutely. So basically, incontinence is defined as loss of urine. And you can have actually two kinds of incontinence: urinary incontinence, which is the loss of urine, or fecal incontinence, which is the loss of feces or stools. And so depending on the incontinence you have, we address that. And incontinence can be of different kinds. You can have stress incontinence, you can have urge incontinence, you can have mixed incontinence, you can have functional incontinence. So may I just give a little description of what each one is? So basically, stress incontinence is incontinence associated with any kind of activity. So like when you cough, or you laugh, or you sneeze, or you're running, or you're sitting to standing, any kind of movement is causing your leakage. That is stress incontinence. When you have that gotta go kind of urgency where you have come home from shopping, you're turning the key into your door and you just have to go, it's now or never. That's urge incontinence. Functional incontinence is where it is a result of something that has happened, and normally functional incontinence is temporary.
Well, could you explain what you mean, something that happened? If you could explain
exactly,
that
and that's what I was going to go to, is like if you had a knee replacement, or if you had a hip replacement, or if you fractured something, and because you're in crutches, or you're non-weight bearing, or you're using a walker, so that is delaying your ability to get from wherever you are to the bathroom. That's functional. But that is something that can be overcome because you're going to get better, you're going to get stronger, and you can get back. So that is a temporary thing. And then you have mixed incontinence, which is a combination of stress and urge. That is where you leak no matter what. You leak if you're doing an activity, and you leak if you cannot get to the bathroom on time. So it's like a double whammy.
Now, which is the one that you mostly see? Is there, or is it a mix?
I see a mix. I mainly see urge incontinence, stress, and mixed. Those are the main ones, because functional, like I mentioned, is temporary. It's only due to a condition like a broken leg or a hip replacement, so that's temporary. So that really is not an issue. But I do see a lot of urge and stress, because statistics show that more than 15 million, almost 20 million of people in the United States, mainly women, have incontinence. But like you just mentioned, it's such a taboo topic that not many want to discuss it or talk about it, though it's kind of coming on the forefront now. And 24%, 23.7% of incontinence is women.
Is with women?
The majority.
Well, there's such a difference between women and men.
There is.
Who
Well,
knew?
actually, I know. That's because we're just better. But so we can do more. The reason is also anatomically women go through more. And one of the things I want to mention is most of my patients, when they come to me, they think like, oh, I am a certain age, I've had children, it's normal. Well, the truth is, it's not normal to have leakage. Just because you've had children, just because you're over a certain age, does not mean it's normal. I literally have seen incontinence in 16-year-olds, and I have seen them in 90-year-olds. So age has really nothing to do with it. It does play a role, but we cannot just dismiss it off. The anatomy, the weakness of the muscles, there are several factors involved.
Now, does weight have anything to do with it?
Absolutely. Weight always plays a role.
And so now, what is the remedy?
Well, there are several things we can do, and that's where physical therapy comes in, because it's a non-surgical, non-medicational option, which is kind of the first line of treatment. So in physical therapy, what you would do, and what I recommend, is always be seen by a therapist that's not just licensed, but also certified. And you can go to the American Physical Therapy Association.
Well, here, let's stop right here. Not only licensed, but certified. What's the difference? How do we know the difference?
Well, that's a very good question. Many people may take a weekend course and say they've done something because, pelvic physical therapy has become a buzzword.
Would that get them licensed?
Well, every therapist has to be licensed.
Every therapist
You have to be licensed in the country to practice, but you don't have to be certified in that area.
And that, I see.
That's an extra credentialing.
Okay, I got it.
And to get certified, you have to go through several series of trainings, examinations, papers that you write, testing that you get done, and it's just better than going for a 1 day or a 2 day course. So that makes a big difference. And so you'd get yourself evaluated and assessed by a physical therapist. And typically what we would do is at your first session, we'll ask you a lot of questions, we have you fill out a lot of paperwork, we will assess you externally, and I always tell my patients that with their permission, we also assess them internally.
Now, does medication, the kind of medication, does that affect this incontinence in any way?
There are actually blood pressure medications. There are medications that people have used for treatment with cancer. In chemotherapy and radiation, one of the big side effects is incontinence. So a lot of these things play a role in incontinence.
So it's not just one effect. It isn't one cause and effect. There could be several elements. So that's why a person needs an evaluation.
That's
that
right.
right.
There are multiple, absolutely. There are multiple causes, multiple reasons, and you need to do a proper assessment to figure out what is going on. And then you can design a treatment accordingly and execute treatment.
Because it isn't one size fits all.
It never is one size fits all.
So it has to be personalized for the person, and it has to be dependent on what kind of medication and what their health status is.
It
is
is
that
dependent
correct?
on everything, absolutely. I always say all 5 fingers on your hand are not the same, so neither are
well,
two
we're
people.
going to get deeper into this, but right now what we're going to do is Vita's Pearls of Wisdom. And in my Pearls of Wisdom, this week is what's considered to be Holy Week. It's Easter. We're taping this show on March 30th, 2015. And so this coming week is considered by Christians to be Holy Week, with Good Friday and Easter Sunday. And Passover is also this weekend. So this is, for Jewish people and for Christians, a big week. Now, I have found out some mysteries, and you know, I'm always trying to pass things on to you that I have found out that work for me. And this is something that I'm going to have you do this week. First of all, I want to explain something to you. There's 4 different kinds of love. The love of God is called agape, A-G-A-P-E. That is love coming from God. The second form of love is called stergio, and that is the love between a parent and a child. The third kind is called phileo. That is brotherly love, for the community. And the fourth kind is called eros, which is romantic love. Okay? Now, what we're talking about is the highest form is agape. Now, here's the mystery of it. Here's the one that doesn't logically fit in your head. You only increase it and keep it by passing it on. You don't hoard it for yourself. So this is what I have set for you to get blessed this week. What I want you to do this week is to get out of your comfort zone. I don't care if you're a stay-at-home. I don't care if you're sitting at home and you can't get out. What you can do is pick up the telephone and call somebody and tell them how much you appreciate them. And that is passing it on. You could be at a drive-in at a fast food and pay for somebody, but when you pay for it, tell them, listen, I'm doing this to you, and what I want you to do is not give it back to me. I want you to pass it on like I'm passing it on. And as each one of you does this one act, I'm going to tell you, you're going to feel a blessing, you're going to feel a satisfaction, not in your head, in your heart. Because what you're doing is you're adapting the principles and you're taking action in the principles. And this is a godly principle that works. I know, because I live this, and I'm passing you on something that's true. And I want you to go into my website or to call me and tell me how this did work for you, and I'll give you another one. See, but this is what I'm passing on to you this week, and I know that it does work. Now, my website is seniorissues, etc., My telephone number is 847-573-1233. And what you do is you pass it on, and that's how we make a difference in this world, and it's nonviolent, and it's the love of God coming through. Have a good holiday. God bless you. Now we're going to get back to the doctor and get deeper into this subject to find out how we could handle this unmentionable subject that we have to bring out in the open. Okay.
The tape's off.
Good.
So basically, when we look at incontinence, we first need to look at the pelvic floor. Now, what is the pelvic floor?
What is it?
So basically, if you think of the pelvic floor, think of a hammock. You have your bones, you have your pelvis, and I'm going to use a few anatomical terms. You have your ilium, your ischium, and your pubis. So if you think of the hammock, it extends from your pubis to what we call the sit bones, to the backbone, the coccyx, and that's the hammock. That is consisting of the muscles, the connective tissues, the ligaments, and the fascia, and that's what's holding your organs and everything
That holds it all together. Okay,
now,
got that.
Over time, wear and tear, muscles can become weak, they can become tight, and that's where issues arise. When most people think of incontinence, they only think of weakness. But actually, urge incontinence, which is a huge kind of incontinence you see, is not just caused by weakness, but the reason the muscles are weak is because the muscles are tight. They are shortened. Now, again, one of the questions women ask me is that, shouldn't I be tight? There's a difference between being firm and strong and weak and tight. And if your muscles are tight in a state of spasm, then they're not doing their job.
They're not flexible either.
Exactly. And if they can't function, they're going to have problems.
Your remedy for that is you have a certain exercise, a certain way they function to restore this?
Absolutely. So basically, once we do the assessment and the evaluation, we go towards a treatment plan. There are certain stretches you can do, exercises that you can do, manual work that can be done internally as well as externally.
What do you mean by manual work?
Manual work such as myofascial release, trigger point release. So basically, you're working on the muscles, the shortened, tightened muscles. You're working on them manually using different techniques to relax them. If someone is not comfortable with internal work, then we can do a lot of things externally as well. Because your back, your abdomen, your pelvic floor, all three of them together form Mother Nature's corset.
So it all hooks in together.
It's all
so
connected.
You can't treat one part without the other.
Nope. I always say God's an amazing architect. Everything's connected.
But is there also medicines that people can take?
There are medicines that you can take, and that is where a urogynecologist or your internal medicine MD can recommend and prescribe some for you. There are quite a few on the market. But again, with them also come their side effects.
Oh, so the side effects. So, but a person could work both of them.
Absolutely, you can do a combination.
Plan can be worked out.
And what you can do is, if you are already taking medicine, you can start with the therapy and slowly wean off the medication and strengthen your pelvic muscles, relax them, stretch, stabilize, and strengthen them to achieve your goals.
Now, is age a factor in this? Say a person, is there a difference between a person like in their 40s and say a person in their 80s?
Well, age plays a role, but age is just a number. So a difference between a person in their 40s and 80s is not just age. It depends on how they have used their body and what they have done to their body. Because I know several 70, 80-year-olds who could put a lot of us 40-year-olds to shame. So it just depends on how well you're taking care of yourself, what you're doing. I mean, you could be a 40-year-old, but if you're a couch potato, and there's nothing wrong with being that, but if you're not doing anything for your body, then the repercussions will be different than if you're an active 80-year-old who's doing things. So it really depends on your lifestyle as well. And work plays a role too. Professions that require a lot of standing. Teachers, because they cannot go to the bathroom, they have to hold their urine. So different things.
So it's a strain.
Different factors.
Different factors hook in. That's why one needs to have a total evaluation, because you can't judge it on what happened to somebody else. You have to really judge it on yourself. Now, maybe we haven't finished this subject, but maybe you want to go over a little bit slower the different types of therapy that is available at your clinic, because I know you in the beginning you went through it, but it went through so fast I don't think people had a chance to grasp it. So you said there was how many different forms of therapy?
We have several. We have orthopedics, so we deal
now,
with...
orthopedics means?
anything to do with your bones, your muscles, everything. So people who have hip replacements, knee replacements, fractures, muscle tears, muscle pulls, strains, athletic injuries, any kind of.
So that's orthopedics. Okay, now what was the next category?
Neurology, neurological. So patients having Parkinson's disease, multiple sclerosis, strokes like a CVA, cerebrovascular accident, multiple things like that. Guillain-Barré, there are so many neurological conditions.
So there's actually exercises for them?
There is a lot that can be done.
And what is some of the other areas now?
We do work conditioning, work hardening, so people who've injured themselves at work and need to get back to work, we do that. We have functional capacity evaluations to assess and see where they are at and what can help them get back to their full capacity. We also have what's called anodyne therapy, which uses monochromatic infrared energy.
Now you're going to have to break that down.
And that is basically for people who have neuropathy, numbness, tingling in their legs, pain because of diabetic or non-diabetic neuropathy.
So you have to explain what neuropathy is. I like to make it clear.
Absolutely. So that could be a condition where your nerves, you've lost sensation or they're heightened sensation.
So what does that produce in the body? A tingling?
A feeling of numbness, tingling, kind of like the restless leg syndrome.
Like a nervousness?
Like a nervousness, you could have that, or you can have people who don't feel anything. You know, you can do a pinprick test and they don't feel anything because of the neuropathy, because the nerves have been affected.
And there are exercises to improve that?
And there's actually a system, a machine system called anodyne that you will put on the person. And yes,
what is an anodyne?
That is what is using the monochromatic infrared energy. It's basically using infrared energy to help with the collaterals and the circulation.
Well, I don't know what infrared energy is.
Infrared energy is a kind of energy, just like you have heat energy, you have cold as an energy. So infrared is kind of like a light energy.
It's a light.
Light energy, yes. It's little diodes. So you have like a black disc with little diodes, and the energy, the infrared, is emitted through it. And you hook it onto a person externally. And
now, is it possible that a person needs like therapy from this group and therapy from another group?
Absolutely.
And do you have to combine them and construct a program for them, taking in? So, like a therapist, you have therapists that specialize in certain things.
We do, and that's the beauty of it, is that it's like a one-stop shop. You can combine and do things.
All right. Now, this is a question that I ask anybody that comes on the show, that you and your husband, this is very ambitious position you put yourself in, and you have a very ambitious life. You have 2 small children, and you're the co-owner of a multifaceted clinic. Okay, now what do you actually get out of it? What kind of satisfaction outside of a financial stability?
Well, my goal has always been to empower every vagina that's out there.
That's a good saying.
I always say more power to the vagina. I call the pelvic floor the cradle of civilization. If there were no pelvic floors, none of us would be here. And so my goal is to really empower them, in men, women, and children, and everything is connected, and that's the purpose of our practice. And the reason I got into physical therapy is because of a saying that I really liked, that my husband introduced me to, that a good doctor adds years to your life, but a good physical therapist adds life to those years.
Oh, that is good. Say that again. Did you catch that? That's so good.
A good doctor adds years to your life, but a good physical therapist adds life to those years. And that's my goal. There's great satisfaction in that.
Oh, that is so good. Now we'll get back to what our main subject is. I'd like to end up with that, with incontinence. So now, how would a person determine? First of all, let's give your website. What is your website?
www.lakecountyphysicaltherapy.com.
www.lakecountyphysicaltherapy.com. Okay, so if they go to your website, there's all the information, and there is also a telephone number. Say they had questions to ask, because one of the questions that I have is, I think it's a difficult decision for a person to come to admit that I'm actually incontinent. Mm-hmm. Or they could just think, oh, I just had this accident. This was just an accident. Mm-hmm. And so how does one determine? Is that a determination in their head that they come to?
Well, there are several things they can do. The simplest is just keep a bladder diary. Just keep a 48-hour account of every time you go to the bathroom to urinate or to defecate, every time you have a leakage, because then you have a visual like, oh my Lord, I went to the bathroom 50 times. That's a little too much. So now you know that yes, there is an issue, and then you can deal with it. And one of the things I would like to mention is that our website not only has our phone number, but it also has an email address that you can, email us your queries. And our phone number is connected to our cell phone. So at the end of the day, when we're done with work, we are still on call 24/7 if patients have questions.
Uh-huh. So if they go to the website, there is an email address, and the email address is connected to
our company.
To your company, and you will get back to them within a 24-hour period.
Absolutely. And our phone number, too, is connected to our cell phones, so we're always available.
Uh-huh. Now, your clinic hours are Monday through Friday?
And Saturdays, too, in Round Lake Beach.
Okay, you have more than one location?
Yes, we do.
So would you like to mention the locations?
We have one in Round Lake Beach, which is open Monday through Saturday, and one in Grays Lake, which is open Monday through Friday.
Uh-huh. And you work through both of these clinics?
I'm at the Grays Lake office.
You're at the Grays Lake office. But you could be contacted through...
Absolutely.
And your husband is at the...
He's at the Round Lake Beach office.
Oh, so you work separate locations.
Keeps the peace. No, I'm kidding.
Oh, that's good that you work separate locations. And how long have you had your clinic now?
Since 1999.
Since 1999. So you're well seasoned in the area. And do you live in the area?
We live in Long Grove.
In Long Grove.
Mm-hmm. In Lake County.
In Lake County. Oh, so that's good. So we will have you on periodically so you can tell us the changes, because I know there's always changes going on. Absolutely. And so the satisfaction you're getting is that you actually are making a difference, and you're seeing people get over things that has caused them a lot of miscomfort. Well, we've come to you today, and we tried to bring subject matter to you that a lot of people don't want to talk about, but you know that we're willing to talk about anything. And remember, go out this week, and I've given you a mystery, and you have to check it out, and check out what the doctor is telling us, because we can overcome everything. Because our goal is to live forever. And when you out there that's sitting on the couch, get up off the couch and open up your heart and open up your eyes. When you come to the end of your rope, you tie a knot and you hang on, because the best is yet to come. And what we want you all to do this week is to catch the spirit. God bless you. We love you.
Thank you.